Welcome to a sensational program brought to you by our YouTube channel. If you haven't subscribed, subscribe and hit that bell icon so that you will receive latest information and videos as and when they are released. Today in our program, we are going to talk about endometriosis and the basic symptoms and the treatment modalities and how do you diagnose that condition. And also I'm going to speak about the Endometriosis Awareness and Support Foundation, which is founded by Rashani Meegama. To do the endometriosis program today, as you know, in our channel, we are always talking about correct information from correct medical experts. So to do that, I have welcomed Dr. S.Jeyakumar, who is an obstetrician and a gynecologist working at District General Hospital. Dr. S.Jeyakumar, welcome to our program.
Thank you. Welcome.
Dr. S.Jeyakumar, just to highlight, because we believe this endometriosis is a condition that is hidden and a silent condition, but a lot of females and girls are suffering from. Just to get the attention from our viewers, can you briefly explain what is this condition?
Yes, definitely. This endometriosis, what you say, endometriosis is a special type of illness or disease which affects the female, the genital system of the female basically. So it is so the something which is normal tissue, it is inside abnormal place. Some part of the tissue of this genital system which is placed in a different unnecessary area. So as you know, this womb, female womb, contains several layers with different types of cells. The innermost layer is called endometrium. So it covers the cavity of the uterus or womb. So in this cavity only the fetus or the baby develops and is born. So this particular type of the situation or the site, this type of tissue, sometimes it is seen outside the place of outside the uterus. So it should be not the original place, in the abnormal, so unnecessary places. So it may cause unnecessary problems like serious pain and various problems in the fertility and family life and the sexual life. We don't actually, how does it happen?
Dr. S.Jeyakumar, just to get our viewers more aware about this condition, what will be the basic symptoms that they will have? Maybe a young girl or a grown-up woman who is married.
Basically it affects the younger population of women. So around 15 and below 45, like below 45, 50, this is called reproductive age group. So during the menstruation, they can have severe pain, severe bleeding. So they will suffer from sexual problems also. So they can't have proper sexual activity because of this pain and irregular periods and heavy periods, and ultimately it will affect the family also. So it will have a lot of burden on the society as well ultimately, because they are going to take leave from the office, a working girl. So it will, indirectly the costs will be very lot for the society as the treatment purpose and the absence.
So, Dr. S.Jeyakumar, is there a risk of subfertility in these females? Like
Definitely. So that's a good question. Actually, the subfertility is the main concern during this age group, that is fertile group, this reproductive group. So usually this condition is very common nowadays. Otherwise we are finding more and more cases because we have more chance of investigations and more gadgets and more methods to investigate. So earlier we didn't know much about this thing, but it has been reported 200 years ago in the history, this endometriosis. When you do surgery, sometimes you don't find till the person dies, you don't find. Sometimes it is in the postmortem there is endometriosis. Sometimes you do surgery for something else, you find endometriosis. Something you do a scan for something else, you find endometriosis. So that's how it comes. But nowadays, this finding or diagnosis is more easy and more cost effective. So we are finding more and more cases of endometriosis usually especially associated with subfertility.
Okay. So, Dr. Jeyakumar, going on to the diagnosis part, so what do you think basically if a girl is having maybe severe menstrual bleeding and severe lower abdominal pain, like and as you know, like more this community is now more into non-communicable diseases. People screen their blood for sugar, cholesterol, they check their blood pressures very often. But I do feel that the endometriosis condition is hidden but not being properly screened.
Yes.
So how do you think that how well we can plan this ahead?
Actually, so this female, they are suffering without telling outside, because this is not an obvious disease, but they only know that there is something in her system. Then, so what from the history, when you study the menstrual story, the history of a particular woman, so you can assume this particular woman is possible. There is a possibility of endometriosis in particular lady. So we fail that is not conclusive anyway. It is difficult to find confirm that. Then we have to go for little more investigations like ultrasound scan. So ultrasound scan, if it is severe form, it is not early form. It is little moderate to severe form of endometriosis. Ultrasound will detect very easily. Still, it is not 100%. So there are many various other diseases, illnesses. It can mimic like endometriosis. So actually, so you want to confirm 100%, you have to go into the tummy and see. So we have laparoscopy. So you can straight away view by sort of keyhole surgery, you say, and take a sample or whatever it is, assess completely where it is. Definitely there are three problems they will be facing, this endometriosis patients. First thing is the severe pain, abdominal pain during the menstrual cycle, or even out of the menstrual cycle they can have pain. So pain is very important, the most important thing. The second one will have dyspareunia. Pareunia means they will have pain during sexual activity. So they can't have proper sex, they can't enjoy the sex. So from that, both these things, they will ultimately end up in subfertility, that is called childlessness. Subfertility is childlessness. So those are three important things: pain and this heavy menstrual pain, subfertility, and loss of sexual activity, lack of sexual activity, or a lack of desire on sexual activity.
So they may basically frightened to have sex.
They will end up in without any children.
So Dr. Jeyakumar, like so we know how to diagnose now. Basically, there will be component of symptoms as well as now there are scans or laparoscopies for that we can diagnose this condition. So going beyond to that, so what can we do for these females? What are the treatment modalities that are actually available?
Basically, since we don't know actually what is happening, what is the possibility, what does it happen in this this particular disease, we don't have a definite treatment. Only thing what we do is symptomatic treatment, symptomatic, especially the pain. So we can reduce the pain. So we know that we can't cure the disease with medicine. So we can subside the pain and keep a little calm and painless for some time, but it will impede her pregnancy. So you treat medications, give medications. So there are drugs which can interfere with the pregnancy chances. So she may become subfertile permanently. So you can't try the particular drug continuously. There are several drugs and hormones, painkillers and hormones. Hormones such as estrogen, progesterone, and there are hormones against estrogen and against progesterone, and there is a hormone called testosterone, which is more in female. Male, but sometimes you may have to use the testosterone effect on female to suppress this disease. So every time they cycle, that's a cyclical change of hormones in a female. So every time the estrogen picks up, so this disease worsens. So what we have to do is you have to stop the menstruation. There are only two ways to stop the menstruation naturally. Once you become pregnant, then you become menopause. So we are trying to create sort of artificial pregnancy, artificial menopause, pseudo menopause, or pseudo pregnancy state. Then the symptoms will be less, but you can't expect her to become pregnant during that time.
Okay. So, Dr. Jeyakumar, like we have always heard that in endometriosis there are things called chocolate cysts inside your tummy. So, what are these chocolate cysts?
Chocolate cyst, we call it chocolate cyst because of the color of the material. They are the ovaries, that is the organs which are producing eggs every month. So this, when you get endometriosis deposits on the ovary, not out of the uterus, so every time you have periods, these deposits will be going on increasing and increasing and increasing. It form like a cyst, means sac-like thing.
Okay.
So this appearance of this blood, altered blood, is not red. It's a brownish chocolate color. So we call this as a chocolate cyst.
Great. So we have heard from females that there are a lot of, and in textbooks we have heard that there are a lot of complications. Maybe conditions like frozen pelvis, that kind of things. What are the complications that this endometriosis can lead into, Dr. Jeyakumar?
Yeah, in early part they are usually not symptomatic. They are free of pain and everything. When it goes and builds up every month, every period is risky. Every period they go and build up the disease. So end up in pain, pelvic pain. So period pain, and they don't like to have sex. They can't have children because of that. So they have torture of the body and the mind is a torture. So they will end up in, sometimes I have seen people getting divorced because childlessness. The wife is unable to produce the children. So they ended up in breakage of marriage. Is a severe thing.
Yes. So finally, Dr. Jeyakumar, just to get the public awareness about this condition, if somebody is having this kind of thing, what sort of basic symptoms that they should basically worry and go to a VOG and get them screened?
Actually, if they are having period pains, which is outdating the periods, it starts before the period, and it becomes severe and severe every month. So they have to think about this endometriosis. It is building up inside.
So this menstrual pain is the basic symptom that they should worry about.
Dyspareunia, that is pain during the intercourse. And they are married for a long time, but there is no children. Childlessness. So that is another thing. All three in combination. So they have to think about it.
Dr. Jeyakumar, thank you so much for your time. I think we have got a lot of information from you about the condition. And just to let our viewers know that the Endometriosis Support and Awareness Foundation, which is founded by Rashani, I'm going to interview Rashani in about a couple of days so that we will have more information about the awareness program. Rashani is a lawyer by profession and also an individual who is suffering from severe endometriosis. So she has created this foundation to create more awareness and support for the people and also to screen and help them in terms of this disabling disease. So I think it's going to be locally and internationally well recognized in terms of Sri Lanka having this kind of foundation and also trying to create more awareness, Dr. Jeyakumar. So thank you so much for your time, and we are really happy and respectful to have you in our program.
Thank you very much.
And with another program, we'll meet you again. Thank you so much.